first of all, I just want to acknowledge the previous speakers. Mary began by referencing the global strategy on diet, physical activity and health in 2004, which sort of brought back bad memories for me, having to debate whether we could remove Jim Mann's paper on sugar to get agreement with the sugar producing countries. So that was a good example of research influence on policy at the highest level, and shout out to Jim in relation to that. What I thought I would do today is just cover what we see as some of the problems, is how as a society do we move towards being knowledgeable about health. And some recent history, I think, is probably worth going through, and it's been covered by some other speakers, the gaps that we have in the system, and a little bit about the health reforms. These health reforms, I think, in a sense, we've got a second chance. In 2000, we also had a focus on population health, but we didn't pull it off, particularly in terms of equity. And as Y2575 pointed out, certainly not in terms of our treaty obligations and Māori health equity obligations. The second thing that's really upper in my mind is the recent experience with measles between 2009 and 2019, which is a sort of classic example, really, where the research in 2015 said we had a gap in our immunisation coverage. It was unable to be prioritised for action. And at the same time, there was events happening in Samoa, which weakened their the vaccination status of their children. And the end result of that was the loss of 80+ lives in Samoa from measles, mainly children. This is a totally preventable disaster, and it illustrates, one, our need to be much more savvy about risks and anticipated risks, but also their connectedness between us and the rest of the world, and particularly our near neighbours. The third tale, I think, is more positive, as some of the speakers have talked about, which is around COVID-19 and the rapid translation of policy into practice that we have seen. At the same time, it has well illustrated the problems we have as society in terms of not having addressed sections of the society have been left behind, not connected to health services or other services, including housing, etc. And the consequences of that, both for those communities and the wider community, when people are left behind. So I think there's sort of settings, if you like, to be thinking about knowledge systems going forward. In thinking about this pathway, we were thinking about it in terms of the data to information to intelligence to knowledge, and I think when we look at that as a pathway, there's some bits of the pathway are better than others, is what I would say. And there's certainly issues around the extent to which we're able to translate knowledge into action. Research is a component of knowledge, but sort of a broader sense of what knowing and understanding is, and I'll talk more about that. And so if you go backwards around that pathway, I think at each level we have heaps of data already, and we're going to have heaps more. But it's then the processes in terms of how it's assessed and analysed, interpreted, communicated and translated into action that are the key. So the elements in the health reform that have potential in this area, I would begin with the Māori Health Authority, which is potentially a game changer. And in this sense, the Māori Health Authority enables a change in who is asking the question in the first place, whose needs are being met, and who's identifying those needs. So consistent with the treaty, but the governance role of the Māori Health Authority in terms of tēnā rangatira in the system and around the research data and knowledge system has to be a fundamental driver in the reform process. So fundamentally, to me, I see the Māori Health Authority as a population health agency in its own right, and a fundamental driver of a different way in which data will be generated, a different way in which the questions are raised, and a different, including in terms of Mataranga Māori, as Matire has pointed out, not assuming a single cultural view of knowledge in the first place. The second item I would, sorry, just one moment. Yeah, the second agency to draw attention to is the Public Health Agency. Now that's going to be the heart of the ministry, as Minister Verrill said. But in this context, we're hoping that it will be a home, or if you like, where the collective knowledge of our nation can come together around health, and where that knowledge can be made more available to decision makers. In the Public Health Agency, it's going to be a distinct entity. It needs to bring together those various aspects of knowledge. And it also, we're hoping that it will acknowledge the centres of expertise that exist across the nation already. So that is a new feature in the system. Rod referred to the guidelines group. I would hope functions such as that, you know, which set guidelines and standards across the public health system, would be part of its role. But fundamentally, it's to bring the broad experience and knowledge of the system together around health, and not just focus on the health system, but focus on the health and its determinants wherever they may lie. The third element I'd draw your attention to is the Public Health Advisory Committee. This will be a committee reporting directly to the Minister. So it provides an avenue for independent advice, one of the issues that was being asked about. And its responsibilities will include making sure that the system is treaty compliant, science-based expertise is being applied, but also community perspectives, particularly Māori and Pasifika communities and other communities who currently have been quite isolated or marginalised in our response to date. So I draw your attention to those three aspects, which I think are crucial to this pathway of that we're discussing today. So in conclusion, I think the health reforms are a real opportunity to strengthen the pathway between research, policy and practice. Those three structures can play a critical role in leading this work. However, the success is going to rely on a wide cultural change, a learning, agile system that doesn't leave people behind. So some practical things to do. Just to shout out that if you have the enthusiasm or the will to lead this agency, the advertisements are currently live, and we'd love to hear from you. Kia ora tātou.